Hello, thank you for meeting with me today. I know that insurance can feel overwhelming, but my job is to help you cut through the noise and land on a plan that helps keep you covered without wrecking your budget. Now, you might be thinking, why work with me instead of just going online or talking to another agent? And that's a fair question. And I want to show you exactly what makes this worth your time. Here's how I would like to run our chat. First, I'll introduce myself and tell you a little about who I am and how I can help you. Then I'll ask you a few questions to better understand your needs. From there, we'll look at different plans side by side so you can see what makes the most sense for you. And just so you know, working with me doesn't cost you anything extra. Your premiums are set no matter where you get your insurance from. What I do is make the process smoother. I'll walk you through the application, keep tabs on it, and make sure you don't miss out on any discounts or any government help that you might qualify for. Just taking a little bit to introduce myself. My name's Erica Huffstetler, and I'm a licensed health and life insurance producer here in Arizona. With 20 plus years in healthcare and pharmacy, I bring the expertise to help you find the right coverage that you need. I am contracted with all of the top carriers for health, United Healthcare, Amber, Pivot, Aetna, Life Insurance, Transamerica, Ethos, Mutual of Omaha. I also have access to dental, vision, access, and critical illness plans. I work with Health Markets Insurance Agency, and we are licensed in all 50 states and the District of Columbia. What sets us apart is that we're not tied to just one company. I have access to multiple trusted carriers, which lets us build coverage that's truly complete. And here's the thing, most people don't realize that there is no single plan that can protect you from every angle. That's why it's essential to look at how different products can work together. Skipping one piece of the protection can leave major gaps, and I couldn't live with myself if we overlooked something that could save you from financial stress later on down the road. So today, I want us to cover each part of your protection because real peace of mind only comes when all of the pieces fit together. Most people want choices when it comes to their insurance, and that's for a good reason. One company alone can't possibly meet all of your needs. That's why I work with a big lineup of trusted carriers. Not all of them are on the exchange, and not all of them offer every type of plan. But here's the key. Having access to many companies means we can piece together the right mix for you. And honestly, that mix is essential. If we only looked at one product, you'd be walking away with gaps in your protection. I don't ever want to have you be in that position. My job is to make sure that you have the most complete coverage that you need to protect your family and your peace of mind. You invited me here to help you examine your healthcare options, and that will be the focus of our discussion today. Once I have a clear understanding of your family's needs and budget, I can show you different options that give you strong protection while still fitting into your budget. It's not just about picking one product, it's essential to fill all three key components: health, supplemental, and life insurance. When those pieces work together, you get the best coverage and the peace of mind that nothing important has been left out. Think of it like a three-legged stool. If one is missing, the whole stool topples over. The same is true with your coverage. Life insurance in particular cannot wait. It protects your family's future in ways that health coverage alone never can. As we look at solutions today, I'll explain why each piece matters and how they fit together to give you complete protection. Life changes all the time. Some changes are happy, like a marriage or a new baby, but others hit out of nowhere, like an injury, accident, or a diagnosis. That's why what I do goes way beyond just helping people pick a health plan. My goal is to make sure you're protected in every area that matters: your health, your paycheck, and your family. I call this protection for life. And honestly, I can't just cover one piece and ignore the rest. If we don't talk about all three, your health, your income, and your family, then there are gaps, and that means risk. And I don't want you or your family left unprotected. Our insurance needs don't stay the same. What makes sense at 30 isn't what we'll need at 45, and it won't be the same at 65 either. That's why I'm not just here to get you into a health plan today and then walk away. My goal is to stick with you long term, making sure your coverage always matches where you're at in life. And if I do my job right, I hope that you will think of me when someone that you care about needs help with their insurance as well. Here's what I mean by protection for life. Step one is health insurance, the major medical plan that covers your doctor visits, hospital stays, and prescriptions. That's just the foundation. But here's the problem: health insurance doesn't cover your paycheck. If you're sick or injured, the bills don't stop. That's where supplemental coverage comes in. It pays cash directly to you so you can keep paying your mortgage, car payment, or even just keep food on the table while you recover. And the last piece, life insurance. If something happens to you, your family needs protection too. At the very least, a term life policy should be in place. From there, you can always upgrade to a whole life or an IUL policy if that makes sense for you and your long term goals. So, when I say protection for life, I mean protecting your health, your income, and your family. Anything less leaves dangerous gaps. My job is to help you build a custom plan that fits your budget, but gives you peace of mind that all three areas are covered. A major medical event can create financial problems that go way beyond the hospital bill. In fact, studies have shown that medical debt contributes to about two-thirds of all bankruptcies in the US. And here's the surprising part: most of those people already had health insurance. Even outside of bankruptcy, millions of adults still struggle to pay medical bills every year. That means health insurance alone doesn't always protect you financially. This is why I stress the importance of having more than just health insurance. You also need coverage that helps with the out of pocket costs, so you're not left wondering how you'll pay your bills while you're trying to recover. When I first introduced the idea of protection for life, I explained that real protection means covering your health, your income, and your family. Even with good health insurance, an accident or illness can still create financial stress. If you're lying awake at night wondering how you'll pay your deductible, cover your coinsurance, or replace lost income while you recover, that's a sign of a gap. Supplemental plans are designed to fill that gap. They pay cash benefits directly to you when you're sick or injured, so you can focus on getting better instead of worrying about those bills. Let's take a few minutes to look at how these plans can fit into your protection for life strategy. Before we begin the actual presentation, let me take a few moments to review some key terms. These may be familiar to you, but I want to make sure we're all on the same level so we're using the same terms. First is beneficiary. This is how individuals covered under Medicare are referred. So if you have Medicare coverage, you are referred to as a Medicare beneficiary. This is a very common term that you will see on government and Medicare information websites. The next term is premium. A premium is the bill that you pay, usually monthly, to have coverage. This is a fixed cost once you have coverage. Premiums may go up when you renew your coverage, but once you have the coverage, your premiums will stay the same until renewal. Most of you may be familiar with the term deductible, but this is a preset fixed amount that you pay out of pocket before insurance begins to contribute towards your medical expenses. A copayment or copay is also a preset fixed amount, but it is applied to a specific service or product. For example, a plan may require a $30 copay for a doctor's office visit. Coinsurance is the sharing of costs, usually a percentage, between you and the insurance plan after you have paid the deductible. So once you pay the deductible, you may be responsible for 20% of the covered charges and the insurance pays the other 80%. We are going to learn about Medicare through Joan's experience today. Joan is 64, preparing for retirement, and plans to enroll in Medicare when she turns 65. Like many people new to Medicare, she doesn't know a lot about the program. She knows it's a federal health insurance plan that started in 1965 as part of the Medicare Act. She knows that eligibility includes those aged 65 and older, those under 65 with certain disabilities, and people with end-stage renal disease. And she will get a Medicare card for that as well. As a highly motivated self-starter, Joan logs onto the internet and does an initial search to find out more. Joan always thought that Medicare was a single medical plan, but it actually has 4 parts, A, B, C, and D. She learns that Part A covers her hospitalizations, skilled nursing, and some healthcare services and hospice. Part B, she finds out, covers her doctor visits, preventative care, diagnostic testing, and durable medical equipment, such as braces and wheelchairs. Part C is also known as Medicare Advantage, which Joan has heard of, but she isn't familiar with. And Part D is for prescription drug coverage. She also learns that Parts A and B are known as Original Medicare. Joan needs to figure out if and when she qualifies for Part A. As long as she has worked 40 quarters or 10 years or qualifies under her spouse's benefits, she can get coverage. Otherwise, she will need to buy into Part A. Since Joan has worked her entire career, she will qualify under that provision. She's heard that Medicare can have some significant gaps in coverage. For example, her Part A deductible of $1,600 will cover days 1 through 60 of a hospitalization. However, if she had an extended stay, days 61 through 90 have coinsurance of more than $419 a day. Should she have a catastrophic situation, days 91 and beyond will cost her $838 a day, up to 60 additional days over the life of her coverage. Skilled nursing has an additional out-of-pocket. Joan finds out that Part A provides 100 days of coverage, with days 1 through 20 having a $0 coinsurance. However, days 21 through 100 have a daily copay of $204. So Part A covers her for hospitalizations and other inpatient services. Joan then learns more about Part B. Apparently, she has to pay a $206 monthly premium for Part B, but that will provide her medically necessary services for outpatient services like doctor's visits or outpatient diagnostics and her preventative care like a mammogram. So she has to pay a monthly premium, and she also finds out that there are additional out of pocket expenses that she can face. There's an annual deductible of $240, which is followed by a 20% coinsurance that she'll be responsible for. Additionally, in most states, providers who don't accept Medicare payment can charge an excess fee of an additional 15% of the total to balance bill. Not surprisingly, like all insurance, Medicare doesn't cover everything. She has a moment of panic when she sees that Medicare doesn't cover her prescription drugs. But then she remembers that self-administered medication is covered under Part D. That leads her to another search. How does she get Part D, and what could that cost her? It turns out that prescription drug plans under Medicare are offered through private insurance companies. To get coverage, she has to be enrolled in Part A or B, and she can face a penalty if she waits too long to enroll. She also finds out that she has options. She can buy a standalone drug plan known as a PDP or prescription drug coverage that could be included with Part C Medicare Advantage plan, and there would be a deductible to apply. But the drug list or formulary is based on a tier system. The higher the tier number, the more out of pocket. She finds out that she could probably expect to pay between $15 and $100 a month for all Part D plans have the same general structure starting with the deductible. Joan knows how deductibles work, but there are other stages that are completely foreign to her. There's the initial coverage period followed by the catastrophic stage. Let's do some research. So, during the deductible phase, Joan is responsible for 100% of the retail costs for her prescriptions up to $615. Once her deductible is satisfied, she enters the initial coverage stage where she will pay 25% on covered drugs. There's no fixed spending cap. Instead, this phase continues until your true out-of-pocket spending reaches the catastrophic coverage, which is $2,100, and the Part D plan pays the remaining balance. The plan will track the total amount paid by Joan until she reaches $2,100. The plan will only track her expenses during the initial coverage phase. When she clears the initial coverage, she will move into the catastrophic coverage stage. During this last stage, Joan will be responsible for 0% coinsurance, and the remainder will be paid by the plan for the remainder of the year. This all gives Joan a lot to think about, and to be honest, it leaves her concerned. In fact, an extended hospital stay or serious illness could ruin her retirement plans, even with coverage through Medicare. She needs to find out if she has options to protect herself against all of the potential out-of-pocket expenses. Joan remembers that her friend Diane enrolled in Medicare when she turned 65 last year. When Joan calls her, Diane explains that she purchased a Medicare supplement plan, sometimes called MedSup or a Medigap plan. These plans, Diane explains, are sold by private insurance companies to work with original Medicare Parts A and B. According to Diane, her MedSup helps cover the gaps left by Parts A and B, like deductibles and coinsurance. Diane had to buy a separate Part D plan since prescriptions aren't covered by med subs. Joan asks if she knows about Part C Medicare Advantage, but Diane explains you can have a med sub or Part C, but not both. Please take a moment to review this table and the variety of plan types available. Joan feels a lot better after talking to Diane about med subs. Before they hang up, Diane tells Joan to call their former coworker Phil. Phil has a Medicare Part C Medicare Advantage plan and can tell her how that could be an option for coverage. When Joan calls Phil, he tells her that she can get a Medicare Advantage or MA plan from any number of private insurance companies. Medicare Advantage plans include all of Parts A and B, and some plans include Part D coverage for prescriptions, known as MAPD. These plans may also have additional coverage for things like hearing, vision, and wellness and more included with the plan. To qualify for a Medicare Advantage plan, Joan needs to enroll in Medicare Parts A and B, live in the plan service area, and she cannot have end-stage renal disease. In a search for plans in her area, Joan finds that most of the plan options are HMO and PPO plans. Regardless of her choice, she has to maintain her Part B coverage, and most of her services would require a copay or coinsurance, kind of like her plan through work. She also finds that many plans have a low or a $0 monthly premium and have a maximum out of pocket to reduce the risk of major bills. The HMO option will require that she gets all of her non-emergency care from network providers, and her care will be coordinated by a primary care physician. Her primary care physician will refer her to any medically necessary services that may be required to get some prior authorization from the plan for those services. The PPO plan options provide coverage for both in and out of network providers, and it doesn't require a primary care physician. These plans would provide more freedom of choice since referrals are not usually required. Cost may be a concern for Joan. With a Med Sup, she'll still pay her Part B premium along with a monthly premium for the Med Sup coverage. However, she'll have little or no out-of-pocket costs when using the plan. She also has to pay her Part B premium with a Medicare Advantage plan, but those plans usually have a much lower or even $0 premium. But when she could have copays and coinsurance when she uses the plan. A Med Sup would allow Joan to use any provider who accepts Medicare, which would give her a lot of flexibility to get care. Medicare Advantage plans have networks that would limit which providers she could use. Even with a PPO plan, if she goes out of network, she'll face higher costs. Joan sees how a Med Sup would be a good fit if she wants to travel a lot and wants the freedom to see any doctor accepting Medicare. If she needs a lot of health services, she may need to figure out how to budget for the higher premium Med Sup plan. She will have to buy a standalone Part D plan with a Med Sup, but she might be able to find a Medicare Advantage plan in her area that includes drug coverage. Joan has a lot to consider before enrolling in Medicare. She's not sure what she'll do yet. She could take Original Medicare Parts A and B, consider a Medicare supplement plan, and then purchase a Part D plan to cover prescriptions. Or she can roll in a Medicare Advantage plan. She might find one available with Part D coverage included. But if she doesn't find one that includes Part D coverage, she will need to add a standalone plan. She remembers that she can only choose a Medigap plan or a Medicare Advantage plan, but not both. To get some more information, Joan attends an educational seminar to see if there are other ways that she can save on her Medicare expenses. First, there's Medicaid, which helps pay some of the costs not covered by Medicare. Medicaid may also provide some benefits that are not covered by Original Medicare. Then there are Medicare savings programs. If she qualifies for one of the programs, she can use those funds to help pay for Medicare Part A and B costs, like her premiums, deductibles, copays, and coinsurance. Extra help or low-income subsidy helps pay for Part D prescription costs such as plan premium, deductible, coinsurance, copays, and coverage gap expenses. Finally, she learns that there may be additional resources through a state pharmacy assistance program and even through drug manufacturers that offer patient assistance programs. Along the way, Joan learns that she cannot get Medicare coverage anytime she wants. When her 65th birthday gets closer, she can initially enroll during the 3 months before, the month of, and 3 months after her birthday. Also, each year she can make changes to her coverage between October 15th and December 7th. This is known as the annual enrollment period, or AEP. That's probably when she starts seeing all of those commercials on TV. She can also make a change if she has a qualifying event or recognized life change outside of AEP, like moving to a new area where her plan no longer participates. To find out more about Medicare, visit medicare.gov or call 1-800-Medicare. You can also visit the Social Security website or call 1-800-633-4227. Now that we've talked through some of the basics, my job is to help you put together a Protection for Life plan that makes sense for you. I don't see myself as an insurance agent. Think of me as more of a benefits advisor. That means I help you sort through the choices and we find what really works without wasting time or money on things that you don't need. So let's go ahead and walk through the fact finder together. That'll give me some details and I can start building the right plan for you.